The dangers of the DEI model. The DEI model is criticized for trivializing the very social issues it aims to address, such as racial and gender inequities. Instead of tackling the root cause of these problems, DEI initiatives often focus on superficial measures, giving the appearance of progress without actual change. That's actually what I've noticed that the nursing profession at the top does overall throughout my history in nursing. What have they accomplished? Their initial goals going back 100 years was to retain nurses, and yet they did everything possible to push them out, especially over the past several years. But they were doing it before that because they've been on board with this. They are the Karl Marx tool that's being used, but they're not the only association. The concept of diversity, equity, and inclusion has its intellectual foundations in Marxist ideology. Marxist thinkers such as Karl Marx and Friedrich Engels emphasized the importance of class struggle and the need to overthrow the capitalist system. The ideology has influenced modern social justice movements, including critical race theory and intersectionality. So that's the problem. It's like everybody wants to say, well, no, there's nothing wrong with diversity, equity, and inclusion. No, they're using these things. It's exactly the same model as Marx. And it shouldn't be in healthcare. And this is what I see that's with that woke movement, because the woke movement is the Karl Marx DEI agenda. Marxists argue that individuals are often unaware of their true interests and are misled by ideology. It's all part of that implicit bias crap. In DEI, this concept is applied to individuals' perceived identities and experiences, which are seen as being shaped by dominant ideologies, white supremacy, patriarchy. DEI practitioners aim to awaken individuals to their true identities and experiences, which are allegedly hidden by oppressive systems. Yeah, but the very people talking about oppression, none of them want to talk about the border. None of them. They deny it. Yet they were supporting open borders. Now they've gone on the down low. They're sort of hush-hush about that. But they can't draw attention, because, I mean, if you're a healthcare professional at a professional organization at the top, then your number one concern, especially when you made everybody lock down in 2020 and say you better stay home because you better not overwhelm the healthcare system, well, then you shouldn't have been supporting open borders, you professional organizations, should you? Because that will overwhelm the healthcare system too. You just didn't want Americans to overwhelm it. Advocating for self-interest. Associations like the Pharmaceutical Research and Manufacturers of America and the Advanced Medical Technology Association lobby for policies that benefit their member companies, such as patent extensions, price controls, and regulatory exemptions. This can result in higher costs and limited access to healthcare services for patients. Everything I see going on right now it's not about patients, it's about money. The other night I was on the adolescent unit, only nurse, okay? 11 patients, and half of my shift I was by myself. Because they were so short-staffed, and yet one of the damn directors said, well, no, we should just keep admitting. Like, there was a time in healthcare, which was a very important part of healthcare, that we were proactive, okay? Which meaning that we would make sure we had enough staff because of something could happen. When you're working in psych, you want to make sure you have enough staff, especially when you're at a hospital where people have had their teeth knocked out. But these directors, they don't care. They walk down the unit and are there for maybe 10 minutes, talk to a couple of patients in the hall, and then they think, no, we can accept more. It's fine. Acuity matters. I know some people may not know what that means, but in psych, we used to consider acuity where one patient, if they're very violent, you could add 3 others onto that one patient. So the acuity you have, but they don't, none of that is considered anymore. Safety is not considered, none of it. And who is running everything? It's our professional organizations and associations with the regulatory agencies. And they are creating a disaster that I do not know how we will roll back. And this is what your crony capitalism is. The ties between healthcare associations and government create an environment conducive to crony capitalism, characterized by rent-seeking behavior, financialization, monopoly, lack of transparency, greed, and self-interest. This has devastating consequences for patients, including high cost, reduced access to care, and poor health care outcomes. Everything that we're supposed to not do. And it's all because of the healthcare association, your professional organizations if you work in healthcare. The U.S. healthcare system's crisis, characterized by high costs and poor outcome, is largely attributed to crony capitalism. This is evident in the excessive administrative costs, unnecessary spending, and lack of competition, as described in Why U.S. Healthcare Costs So Damn Much. And U.S. healthcare system is bleeding us to death by design. By design, yes. It was always, I said before, it was alarming to me that, all of these big hospital systems, they're all monopolizing. They have been, they'll continue to do it. That's what I don't know how you break them up. I don't know how you roll any of that back. Worst thing these people were allowed to do. So you can blame the government, okay? There's definitely enough to blame them for. But it's all of this private sector that's the problem. The increasing presence of corporate capitalism in the healthcare industry, as seen in the analysis of cancer mortality rates, has led to a concentration of power and resources among a few large players. This has resulted in higher costs, reduced competition, and decreased access to quality care. Now, under a free market, a truly free market, which we don't have, under free market capitalism, innovative and consumer-friendly corporations thrive and make the most money. In contrast, crony capitalism favors corporations that are pro-producer, corrupt, and manipulative, leading to inefficient allocation of resources and harm to the economy. And that's what we're crony capitalism, that's why leadership, at director levels where I work, sees that there's only one nurse on a unit and thinks, well, she can handle it, it's okay, let's just keep admitting more patients. That's somebody that should be held responsible. That's the other thing that needs to start happening here, is no longer are you to be throwing the nurses at the bedside under the bus, when the leadership is the people that should be held responsible. If they are going to go along with unsafe agendas, and they know, nursing leaders know, if you're a chief nursing officer, if you're going along just because your corporate administrators are telling you to, then you are putting your staff in dangerous situations, and it's all the time, then you know better. And you're going along with it because you think nothing's going to happen to me. That needs to change. Lack of transparency. The American Medical Association's Specialty Society Relative Value Scale Update Committee sets prices for healthcare services, illustrating how private for-profit organizations rather than government regulate healthcare costs. The lack of transparency and accountability enables crony capitalism to thrive. Greed and self-interest. The testimony of healthcare professionals, as mentioned in the Economics of Medicine, highlights how hospitals prioritize revenue generation over patient care, demonstration on how greed and self-interest drive the healthcare system's problems. That's exactly where we're at. Nobody wants to say it, but that's where we're at. And again, about this AMA's relative value scale, 29 physician, 27 specialties, and 2 primary care physicians. CMS sole advisors on medical services valuation, secret proceedings, sham survey methods, compositions underrepresentative of physicians in market, and financially conflicted. CMS has historically accepted 90% of their recommendations. We live under a corrupt healthcare system.